Hi, Dr. Riaz Agha here at Harley Clinic on Harley Street. I want to talk about tummy tucks, with or without drains, which is better, the pros and cons. I used to traditionally do my tummy tucks or abdominoplasties and leave 2 drains in. That's what I was taught and that's what I did early on in my practice. The trouble with drains is that you've obviously got a drain coming out each side and it can be difficult to for a patient to logistically manage that. You know, if you want to open the door and you're holding 2 drains, it's very difficult. You can't really utilize your hands as much. It's difficult if you've got children at home, you've got pets, they can yank on them, they can pull on them. I then did switch to try and having them both coming out the one side, so that only one hand is being used for that and holding a bag. But again, you've still got the issue of not being able to use both hands. Practically, it's difficult if you get caught on things. If you're also wearing tight garments, you're compressing that cable against the skin, which can be very irritable and painful and tender and difficult, and you know, skin can get sometimes a bit sore and red from that. So again, that's not good. You've also got the drain hole through which it's coming out of. Sometimes you can get scarring issues with that, and that can be a problem. You get hypertrophic or keloid scarring even. So again, it's not great to do that. I did convert almost a year ago to doing drainless tummy tucks. Now, drainless tummy tucks are a big step forward because you get rid of drains completely, and what you do is actually stitch down the flap underneath to the underlying muscles. So you're gradually pulling the skin down, stitching, pulling the skin down, stitching, pulling the skin down, stitching. So you can get a lot more contouring of the abdomen with that. You can get more of a six-pack definition. You also create less tension on the wound at the bottom because you've been stitching it down progressively as you go. So there's a lot less tension at the bottom. You think it's going to excise even more skin because of that. That much greater contouring means that you can actually not have a big space that's being controlled by a drain and the fluid is going off into the drain, but actually those small sub-compartments that you create with all those stitches, they heal much quicker, they produce less fluid, the garments go on and compress everything nice and uniformly, and you heal quicker, produce less fluid, and there's less risk of problems generally. You could do contouring to an extent with the stitching underneath with the drain, but the problem is you've got the drain in the way, so it's not very easy to do, it's not very practical. So actually you want to be able to just have the whole area to be able to stitch it all down, create a big space into multiple small spaces, let them heal quickly, not have tension at the bottom so you get a wider scar, have less tension on that scar, much more contouring underneath, much more healing. And they call it drainless painless. Now, I wouldn't say it's painless, but you do get less pain because there's less tension. And I think overall it's a much better experience. It's good for those with pets and kids, and they can have both their hands free and have their garments on. It's just so much a better experience for the patient, and it leads to better results. So that's what I tend to do. The vast majority of my tummy tucks are without drains. They are drainless.